Hello, ma'am. How are you? First off, I would like to congratulate you on your pregnancy. My name is Jeremiah. I'm a nurse here. And the reason for my visit is we're going to talk about some of the needs why it's important for you to have proper prenatal care, evaluations, and the appropriate treatment during this pregnancy. The reason it's crucial to do these things is because we want to make sure that you're able to keep a healthy status for not only yourself, but your baby during and after pregnancy. So, first thing we're going to do is we want to start this treatment right now during your first trimester. So what we're going to do is we're going to get you scheduled with an appointment for your OBGYN. And once you get established with your OBGYN, they'll be able to see exactly when they need to make appointments for you. They'll have it scheduled to exactly what your needs are. So some of the things you can expect at these appointments are they're going to do lab work. They'll probably get blood, they'll probably get urine samples, and that way they can have a baseline in case there's anything they need to trend. They'll also get your weight. They'll do ultrasounds. They normally do one at the beginning to find exactly when your due date is, and they'll do one later on during the pregnancy. That way they can determine the sex of the baby. They'll also, if you're on any medications for anything, during these appointments, they'll be able to change, adjust as needed for you and your baby. So the reason why these things are so important is because we want you to go see a doctor regularly so we can watch and make sure that you're not developing anything that could harm you or the baby during pregnancy. Sometimes when we don't get prenatal care, we may get some type of illness or disease that's associated with pregnancy, and it can cause you or the baby to have harmful things happen. Some of these things that we are going to look for are, we want to make sure that you're not anemic. If you're anemic, they may want to replace iron. They're going to want to check your blood sugars initially, and they'll do a glucose test to see if you maybe might have diabetes. That doesn't mean you'll always have diabetes, but you might have what we call gestational diabetes, and that's diabetes during pregnancy. They may need to treat that with drugs such as metformin or insulin, and once the pregnancy is over, there's more than likely you'll be not having to take those medications anymore. Other things that they're going to look for is hypertensive disorders. So sometimes when women get pregnant, their blood pressure can increase, and lots of different things cause that. So want to monitor your vital signs, and if you're hypertensive, they're going to look and make sure that you're not suffering from something that they call preeclampsia. And if you are, they're going to want to treat that because that can cause problems for not only you, but it can also harm the baby. Other things, when they do ultrasounds, and what they're going to want to look for is they're going to want to make sure the baby's healthy. So they're going to just monitor the baby and make sure that there's no fetal anomalies that are going on, make sure that baby's healthy, and they're going to just watch for all the sorts of stuff like that. But thank you for letting me talk to you, and if you have any questions, we'd be more than happy to help you schedule an appointment with your OBGYN or help you with anything else that you may need. And once again, congratulations.